All right, well, my name is Christina Strong, for those who don't know me. I'm a video and communication intern here at MSU HR. And today I'm going to be talking about a project that I worked on as part of the MSU Global Translational Scholars Initiative. It focused on health communications. And so as I walk through the presentation, you'll be able to kind of follow along with some of the stuff in the binder, because it's kind of broken down to the same sections as in the presentation. So background. So the project that I was working on, which is titled Employing the Use of Multimedia and Improving Health Communication Strategies, was conceived in 2013. I wanted to do a project that focused on communications because that is my job role here as an intern. And I thought health communications would be interesting because, I mean, that's a lot of what people are focusing on with ACA, and health is a big thing right now. So again, the project was developed as part of MSU's Global initiative. And it was, again, it created to enhance my work experience here. And so that's the reason I focus on health communications. So what is a translational scholar? This is the definition from MSU Global, which I just help actually. But translational scholars is an enhanced student work experience designed to engage students in the development of solutions to real research problems. Through the process of engaging with faculty, staff, peers, and community stakeholders, translational scholars will develop open educational resources, or OERs, that can be published, repurposed, and shared. The goal of this experience is to look at problems from as many perspectives as possible and produce educational outputs that will aid in the development of research, provide a service to the community in need, and produce an educational experience that is transformational to the student. So my project mission or goal was to create health care videos from a benefits perspective for the MSU community that came from MSU Human Resources and aligned with the desire to function as a high-performing organization. As you know, HR is currently in a stage of transformation, and so we want to streamline the processes and create, initiatives or programs or things that will help HR to stand out as a place for MSU employees on campus. So project breakdown. So I'm going to go through the presentation just the same way this slide is broken down as. I'm going to talk about the project overview document, the survey of the benefits-related staff, the tracking progress, or basically again, healthcare notes and me taking notes to remember what I was doing as I was going along and looking at the process later, and also the process of creating an actual video. So project overview document, which is like the first piece in that binder. So the project overview document is the first thing I start off with the project. I had to come with the idea of what the objectives would be, what the goals of the project, deliverables, the approach, the team, and the stakeholders. And so I worked on this with Rashad from MSU Global to develop. So some of the project objectives, which are on page 2, just included to provide alternative methods of consuming instructional content, to create a database of open information that is readily accessible for employees to use in their benefits-related communication with faculty and staff, general information that was not available or specific to MSU, but could be used for other universities. So if it's something general, like saving for healthcare and retirement, other universities could also use those type of videos. So that would be an OER example. The videos could also provide health and wellness channels that can be created on a platform such as YouTube, that could be collaborated on in the future by multiple departments across campus, such as Health U, the University Physician's Office, and others. We were hoping to, at one point sometime in the future, to dub the videos in different languages to eliminate the language barrier for students and faculty that are international, so they can understand and be able to take advantage of health-related services, and also to begin working on a project that will be ever-changing and evolving, and invite other university units to participate in it as well. So project deliverables. So the project deliverables that I started out with in order to complete this project included creating an initial calendar of videos, also creating an initial video for feedback and testing, and creating an accompanied PDF, slide presentation, or a Word transcript that will go with each video. Because each video is designed to, if it's possible, to have some sort of accompanying piece that goes with it. So I did a survey of benefits-related staff, so people in total compensation and wellness in the Solutions Center. So the survey was sent to 23 staff members in the Solutions Center, and total compensation and wellness. Out of that, I got a response of 14 people, so N equals 14. My results were to try to discover what specific area and benefits from actual benefits-related staff themselves could use the creation of multimedia tools. And it was discovered that retirement was a topic that most of them considered benefits could use multimedia tools in. So the survey captured different questions, asked different questions like how long have you worked at HR, what focus area do you work on most, what's your comfort level asking or answering benefits questions. And so some of the highlights from the survey was the majority of staff that answered worked at MSU HR and benefits related customer service for 3 to 5 years. And a majority of them
35 years?
3 to 5. 3 to 5 years. They all were here for 35. 3 to 5 years. A majority of the staff members felt comfortable answering benefits questions. 57% felt very comfortable, 21% felt slightly, low 21 felt uncomfortable, and then 0 were not familiar. So I also had them rank in order their communication tools and what they would say was the most effective from their perspective. So number 1 was face-to-face meetings, number 2 was phone calls, number 3 was emails, presentation orientations, website, and then brochures. And actually in the binder too, the health communication report section has an actual full report that I wrote up about the entire thing. I'm just taking clips out of it. It starts on it's in the second section after the divider. Yeah, see it? Yep, that right there. And yeah, it's right after that part right here. First section. Yep, right there. And so the top 3 communication methods that were employed by staff in total compensation and wellness were you use telephone the most, email second, and then face-to-face meetings was the third. This is a direct quote that was taken from the survey as far as the open additional comments and questions, which I ended up coding, and it talks more about that in the report. But it said that I find that using emails with links to our web information often gives individuals the information they are looking for. They often don't know where to look on our website. Most employees approaching retirement still prefer an individual appointment. They see retirement as a large decision and often want confirmation, understanding, and information provided. I rank presentation number 3 in effectiveness mainly because I spend so much of my time with emails, phone calls, and appointments. So from anecdotal stories though, I was told that younger people tend to still go online for the information, and it's the older people who want more of the face-to-face because they really want the confirmation. The younger people still just look online and say, oh, I'll find my information through the internet. So moving on to the next section, health communication and project notes. Again, this portion was just a matter of me recording what I had done over the process, whether the mishaps, the good, the redoing, the edits, all of that stuff was listed in notes so that I won't have to go back if I ever wanted to and say, how did this process work? Exactly what did I do? How did I get where I got? Or if someone wanted to duplicate it or even continue the project further along after I leave. So health communications project video. So the video was created from information available on the benefits section of the HR website. Because of my limited time frame and now me moving to go into a full-time position, I wanted to do videos that were a little more in-depth after talking to people, but I didn't have as much time as I would like. So I did take information that I was able to find. It's a sheet called Thinking of Retirement for MSU, and it's broken down to 3 sections. It's 3 to 7 years, 1 to 2 years, and 3 to 6 months. So the videos were intended to be like part 1, part 2, and part 3, but I did just part 1, which would be the 3 to 7 year section. And the goal of videos, the actual main goal, is to take really complicated information and to make it so that it's simple for people to understand. But another useful tool for creating the videos is to take information that seems long and a whole bunch of text and hopefully engaging people to get them to want to go read more about what it is that they should be reading about, otherwise just looking at a long sheet of paper. And so it was based on this document here. You see, for people who probably have seen this at one point in time, but just in case, this one right here. And so I created the video using a software called Powtoons. There are several different other software programs out there that HR could use if they're willing to pay the subscription fees, like GoAnimate, Sparkle is another one. I prefer to like GoAnimate a lot. But unfortunately, unless you're paying, you're not allowed to use it. So I went with Powtoons. It does have branding in it because it's not subscription based, but this is just a small like sample of what could be, I guess, in the future.
think I could
That's a break.
settle brand
But yeah, that's there you go.
Very cute.
So actually, if you look to in the binder, there's a screen capture of, if this had been a Go Animate video, some of the things that would have looked like it. It's funny, you can screen capture the images, but you can't actually produce a video. So this actually would be like a sample too of what a PDF, basically of what the video said. If someone wants to read a print version of it, could see the video in a print form. Be like, oh, okay, this is what it said, this is what it said, and hopefully this would drive them to click on that link and actually go read more and think about retirement, which is important. So, are there any questions?
So I'm always interested in whether or not you think this was successful, and then how do you measure success?
Well, I can't say if it was successful or not because I didn't get a chance to actually physically test it. I just kind of created it. But if I was going to actually measure the success, there are some measuring success tactics in the project overview document in number 5, it's on page 5. The engagement metric was how long are people spending watching the video, the number of plays over time.
How do you measure that? You have some kind
You
of...
put it on like a YouTube channel. So the goal was to create a health and wellness channel that employees could go to, and then you would have those numbers, those analytics from YouTube, and maybe even Google Analytics because you can connect that to YouTube. And then you would...
So let me just ask you.
Yeah.
So it says how long are people spending watching the video? So is there an opportune amount of time that they should spend on it, or what?
I think it depends on how long your video is. Since this is a minute and 18 seconds, it would be beneficial if they're watching the entire video, because if they cut off in the first 10 seconds, they literally have learned nothing. But if it was like 10 minutes and 5 minutes is like a really good time frame, or even 4 minutes, because people's attention spans are very short. So as long as you're getting at least half of what you want to get out, I think you're doing pretty well. But these are just like number-wise, like analytics that don't really give like really in-depth information. So for me personally, I think this is just the first step of, I would say, analyzing or measuring success. To me, the second step would be to actually bring people in and have them give feedback on the video themselves, like a focus group type of session. Have people watch the videos and answer a survey before they even start watching the videos. What are their habits in retirement? What are their habits, what they do currently? And then send them like, I don't know, two videos a month to watch or something. And then survey them again and see if their habits have changed. Have they remembered what they learned? Have they been engaging? Have they been utilizing the tools? And to see what feedback they would give over this course of time. So almost like a study in a way. You know, you're studying and measuring and you're changing based on that.
So purpose, so let's just talk about this video. So purpose of this video would be to drive people
To actually go to
the
that
website,
right.
to actually look at it.
Yes.
So would there be, how could we measure this? How could we measure whether or not a person looked at this video and then went to the website?
When you do analytics, usually there's referral sources, so it'll tell you where the person came from, how they got to your website. So if it says, you know, YouTube and has that link, we can click on it and see. Oh,
we have that established.
Yeah.
One has Google Analytics established, so we'd
Yes.
be able to see if how many people came from YouTube to that
to that
their
website.
page.
Yep, you'd be able to track that and have your numbers.
Okay.
Any other questions?
I was just going to comment, being the retirement manager, I love this type of stuff. We try to push a lot of our customers to videos that our retirement vendors create, but it is, obviously, you can't customize those. So I like how you use the 3 to 7 years, the Road Next Travel grouping that we have, 3 to 7 years and the 1 to 2 years, because we get a lot of our employees, they do exactly as you referenced. They will contact us and say, I want to come meet with, sit down and do one-on-one, make sure that they really understand that. But I think, as you mentioned, a lot of the information I've seen that says the millennials, that the Generation Y are going more to the websites, and when they're ready to retire, they're not necessarily going to come in and speak with somebody face-to-face. So I agree with you, the video is definitely a direction that we need to go.
And there's so much more you can do with it. You can do live action animations, you can do in-depth interviews, you can do mock sessions. Here's a mock retirement session, and talking about what you're going to do You could do life after retirement for retirees, like, so you could do a lot. Actually, speaking of which, this is just like, you can pass it around, but that's kind of how I plan out my videos. I kind of list what I want to do, how I want to do it, what I need, who I need to talk to, what the subject is going to be, what multimedia additions could be used with it. And I planned out, I think, at least 6 or 7 on there, maybe, or 5 or 6 that I won't get to, but.
So, I got a couple things. Let me just say this one real quick. Now, we actually bought a subscription to Powtoon. So if you want to redo this,
Okay.
they have the brand.
Okay.
Okay. And the other piece is, now I want you to tell us about your experience working with your faculty member
Mhm.
and what you actually learned from this, and perhaps how this experience can help you wherever you go next.
What I learned from working on this with my faculty member was she gave me some good ideas when it came to putting together a report and actually like writing all out everything that was said and kind of giving me the structure for like how a report can be done. And also the n equals 14, some statistical stuff. Like, I don't know what that was. I was like, what is n equals 14? It's a statistical thing. Oh, okay, that makes more sense now because I didn't know that. I thought it was success rate or something. She's like, no, it's response rate. I was like, okay. So that was really beneficial. And sitting down with her, just like brainstorming ideas and ways to present it was helpful too. I think overall this project was really good because it gave me the opportunity to be in charge of a complete project from beginning to end. And honestly, I think it's a project that has a lot of potential, if someone wants to continue to do it and utilize it and move forward with it. And if for some reason that HR continues to work on translational scholars, or they continue to do this particular project, it's like a little groundwork for someone else to come in and be able to keep going. So I feel like I've kind of laid a little bit of groundwork, so to speak. Yes.
And raise the bar.
I raised the bar. There you go. So I think that I can take away that I was, the not guinea pig, but one of the initial, scholars in a pilot program at MSU that maybe goes on to really make a change at HR. Maybe it goes on to have a certificate, but I can say
Now,
that.
how do you think you're going to use this experience as you go?
Has that worked? Has it gone work? I think I'm going to use it probably in the sense of like project management and identifying all the people and all the steps you have to take before you can have a project come to completion. I've done project management before in like class and everything, but this is like applying to the real world. So I can take the same project management skill set to any other place that I go because you're always going to have some big projects that you're going to have to do. Or little ones too. Bigger ones that usually take more time to work, but yeah. So yeah.
And so, what could we have done to make this experience, be different or better for you?
I think the only thing I can think of right now, it would have been helpful to accompany Bethany to benefits communications meetings when I was working on the project. But besides that, that's primarily the only thing I can think of right now. And also, if you guys subscribe to Go Animate, that'd be really cool for the future because I like Go Animate.
What are some ways we could strengthen the tie back to CAMI or other faculty work so that this projects like this are, you work with CAMI to do some initial things, but what are ways we could strengthen that faculty research tie? Because the idea came from what you said over a year ago, like, we want to use MSU's own expertise in how we re-engineer our processes and how we can do continuous improvement based on research, based on faculty knowledge. What are some ways we could strengthen that aspect?
Well, for this particular project, I know originally you were trying to give me work with Maria Lipinski, but she's like so busy all the time, so it was Cami, and Cami was great. But I actually referenced Maria's work and storytelling, the storytelling approach to video creation. So for me, I think that was the tie. It's like if these are successful, if the storytelling approach, it's referenced back to the actual faculty members' work that talked about why storytelling and communication is.
That's a good story. That's the kind of story that you're looking for.
Yeah.
That's the kind of story that should be in your newsletter, that part, right there.
I need that piece right there.
Yeah.
Okay, so you okay.
How this project
Ties back
built
to
on, ties back to your
Okay.
reference to faculty work. And then, if you continue this, it's great to have someone, because it's hard to invent something brand new from scratch and there's no clue what you're talking about. You invented a new relationship here. And if you can, see what worked, what didn't work, what would make it even better, so that you can, imagine going now to somebody in comm arts, and saying, this is what we did, in what ways do you have students and does your research inform what we're gonna do next? And now they have an idea of what you're talking about, so it shouldn't take so long to get the connection started and productive, because I know that was hard to do in the beginning, because you
Yeah.
invented something totally new. No one had any clue what we were talking
They're
about.
like, yeah, we're talking about, right?
What do you mean? It didn't fit into any existing
That's kind
category, you know?
Yeah, that's how Cammy felt when we first met with me or shy. She was like, okay, so what is this? What is this thing you're talking about?
But you know, let me stop there a minute, because this is really important for us. So we have done all kind of surveys, internal, external, you know, anecdotal kind of things, focus groups, etc. Trying to find a way to communicate more effectively. So that means that what we're trying to communicate is having the effect that we want it to have. And so we struggle, but you know, we are really open to new and different ways. So you know me in PowerPoint, right?
Yeah.
Death.
As in, you're gonna kill the PowerPoint? Or
Yes, I'm gonna kill PowerPoint before
Or
it
death
kills
by
me,
PowerPoint,
before
huh?
it kills me. And so what you have done, this whole thing about the storytelling approach is very intriguing to me, and it's something that I would want to pursue, you know, with the researcher and all, to in fact create some kind of communication, a different way of communicating than we have done in the past. So I want this to end now, so we have to find a way to keep it on, because this really touches on what we really need to, what we're trying to do. So, yeah. So, you know, let that, you know, how we keep in touch.
Okay.
It's given me some additional ideas for solutions team-centered training, because we face some challenges. Our training's going okay, but a lot of it is very PowerPoint-based, and it is very dry stuff. And dry stuff does not stick with people. You penetrate for a few minutes and then the eyes glaze over. Some interesting thoughts for maybe even outside of external audiences for using some tools that are a little bit more fun and able to package and give them in little bites when they have a spare, 2 minutes. Some interesting things for internal communications as well.
Do you remember how much the Go Animate subscription was?
And no, it might have been like $800 a year or something like that. And then I think that was like the medium one. They have like another one that's like, if you need, for a whole bunch of people, then it's something more.
So I definitely like, it's got a good combination of fun, but it's definitely more clean and professional than Powtoon. Powtoon kind of irks me. Some of them irks me a little bit too commercially salesy. I want people to think that we're serious when we send out our
Do some
communications.
fun
too.
stuff with animation.
And still have some fun. Like, I always look at this compared to the Powtoon. I like this visually.
I have an idea. This is just an idea. So it seems like, this is a great foundation. What a great example. This is so happy about it. There's an acting dean in comm arts, right, Steve Lacey. And there's a new director of the Sandbox, who's David Wheeler, who started here right before the holiday, like in December. And the Sandbox is the student majors that include journalism, film, games, and people that do like PR and publications and stuff. And now that you've got something started, and based on what you just said, I wonder if you want to actually go to the dean and say, I don't want to just have a student just do it as an intern. I want to tie it to your research. Is there some way we can, now that you see what we're doing and where you want to take it, paint a picture moving forward of like what you do in the coming year, let's say. Go now to Steve and say, how can you help we collaborate as HR and as the dean to do something really unique and research-based for HR. It's different than knocking on the Sandbox door, hey, can I have a student? It's really a research collaboration.
I think he would really be, he's like my favorite professor in my undergrad ever. I think he would really be.
So yeah, I would suggest take this, go, you've got initial research, you've got initial product, you have a vision for what you want to do, you already collaborated with Cammie, pitch it to him and see if he wants to collaborate.
So you got all that information?
I do.
He's a good guy.
You got a basis. Last year was too hard because nobody had any clue what we were doing.
Right.
Also, we decided, based on the work that Rashad's been doing with you guys and also with the Global Food Center, Global Center for Food Systems Innovation, we're going to create, and I don't even know if I told Rashad this, we're going to create student fellows next year. We have right now faculty innovation fellows, you know that, and we've been thinking a lot of these faculty need really skilled students that know this kind of information. So we thought, maybe we should just create, just dub these, recruit some great students at the graduate and undergraduate level, and take the translational scholar idea, and maybe we even keep calling it that, I don't know.
Right.
But formalize it so we can kind of create a pool of these people who are prepared to serve in these kind of roles. So anyway, that's kind of what we're going to do next with this whole notion, and that's one of our goals for next year.
So, we're in